It's your life, it's your heart. Smarter Heart University, your institution for higher heart learning without the confusion, where everyone can get a passing grade in life. Attend Smarter Heart University with Dr. Scott on AM 970, The Apple.
Good morning, class. This is your Smarter Heart University. As always, I'm Dr. Scott, along with my co-host and cardiology partner, Dr. Robert Kaiser. Good morning, Bob.
Good morning, Scott.
Today's topic, I'm going to get right to it. We have a lot of information to talk to you about today. Men and women are not just from Mars and Venus. They are from different universes altogether. We're going to prove that today. It's pretty interesting because we're going to give you a study that came out 6 years ago and turned the cardiology world upside down in terms of how we treat women. At that time, volunteered my services to be the women's director, and I was told flat out, well, you can't do that because you're a man. So I spent the past 6 years really honing my skills and really paying attention to this study as it continued along, and that's what we're going to provide for you today. We had some phone trouble last week, didn't we?
A little bit.
That's how we learned, right, folks? Callers, and we do hope you're out there today, 866-970-9622, for any and all of your questions, as always. Right to our topic. Our Smarter Heart popular question of the week. Women don't really get that much heart disease, right? Wrong. What makes it that women and men are different? Facts. Most women, 25 to 44, think breast cancer is the leading cause of death. And while heart disease is more frequent in men, the incidence is actually decreasing in us. But since 1984, heart disease is actually increasing in women, and women dying from heart disease is increasing. Now, men actually tend to have a higher rate overall of dying from heart disease, but when women have heart disease, they stay longer in the hospital, they get greater disability from heart disease, and they end up with a whole worse quality of life. Women with heart failure, that's fluid in the lungs, shortness of breath from a weak heart, have a much worse survival than men. And while the irregular rhythm, atrial fibrillation, that's a big plug from last week. We urge you now that our website is fully interactive, www.smarterheartuniversity.com. You can now sign on and listen to all of our lectures, atrial fib, stress in the heart, real diagnosis of a heart attack, and heart drugs in the media. You can listen anytime you want. 2 days later after from today, you'll be able to hear any of our lectures anytime you would like. And we're on YouTube now at SmarterHeartU. Is that it?
I think that's SmarterHeartU.
SmarterHeartU. So you can watch most of our lectures on YouTube. Women who have atrial fib have a much higher risk of stroke. Popular question number 2. What do the standard heart risk factors actually have to do with the sexes? So let's break each one down. Diabetes, number 1. It narrows the gap between life and death between men and women. Now, for diabetes for everybody, it worsens the lining of your arteries. It worsens your cholesterol, makes it abnormal. It's a plug for next week. We're going to talk a lot about that next week. And the clotting factors of your blood, so therefore you get more heart disease. Fact number 1 about this, high blood sugar prevents the normal vascular protection that women get from their hormones, estrogen and progesterone, before menopause. So in general, women lose about 10-year cushion, the 10-year cushion that they get from having estrogen and progesterone running around when they have diabetes. Also, estrogen directly decreases, along with menopause, decreases a woman's arteries, their ability to relax with stress. So they constrict more and they form more disease. Bad fact, in general, to date, women who have high sugars actually get treated less. Cholesterol is next. Next to your weight, it's the easiest thing to modify. We try, like everything in our office, to do so. Women over 50 with an average of 40 to 60 years of old, the bad LDL cholesterol increases due to this lower estrogen. The HDL, good cholesterol, decreases, and this actually is predictive of your mortality. Triglycerides increase, but there's no unifying evidence as to whether or not that predicts mortality at this point. Next, smoking. More men smoke, but recently more women have been said to smoke. Why? Number one reason is child and family stress is the major issue. Women have been shown to have a much harder time to quit smoking. And then, of course, the question is there a greater risk of smoking in men versus women? The answer is yes. Smoking cuts directly on women's estrogen, and therefore, for the same reason with menopause, it basically causes an early menopause, and you lose that 10-year cushion again. Smoking and diabetes, loss of that 10-year cushion. And lastly, emotions. Again, if you haven't had a chance, that was one of our favorite lectures, Stress in the Heart, Emotions in the Heart. Depression increases heart attacks 25 to 80% in women. And the most cynical and hostile and least optimistic women have statistically the higher rates of heart disease. I love saying it in the office and getting a big response. We talked about that a lot. So what's your opinion about all this, Dr. Kaiser?
Well, women... 1 in 4 women die of heart disease. 1 in 8 women die of breast cancer. So heart disease is the biggest killer in the United States. And actually, the World Congress of Cardiology just recently had a meeting in Asia, and that Congress actually had a symposium just on women's health disease or women's heart disease. And out of that, the international community came to the conclusion that worldwide, heart disease is the number one killer of women, more than anything else. So it's a worldwide problem that is underdiagnosed and undertreated, and why the American Heart Association has that go red. And actually, that World Congress is trying to press that out to the rest of the world, not just the United States.
It's not just the rest of the world as patients, it's the rest of the world as doctors.
Yes.
We're going to talk about that in terms of recognizing symptoms in one of our segments, but it's recognizing it by the physicians as well, in the emergency room, in the office as well. Now, question number 3, are there markers in the blood that can help predict heart attacks? Yes, there's 2 big ones, and yours truly follows this a lot in the lipid world. We have 2 separate shows. They're so big to come in the future. C-reactive protein, that's the packed men and packed women of your body. It is the most significant predictor of cardiovascular risk in healthy postmenopausal women. It's independent of how high your cholesterol is. And yet, there's been a lot of talk in the media in terms of whether or not we can actually test for it anymore. But to date, if your number is high in the high-risk group, your risk as a woman increases 50% for a heart attack. Now, as I just alluded to, at present there's one study that claims that it doesn't add anything. And what happens when you get a study like this is that the insurance companies kind of jump on it, and they're threatening not to pay based on one study. As the PhD and the cardiologist who first came up with this molecule, C-reactive protein marker, we have 10 years of evidence that completely counters that and says how useful it is. Lipoprotein little a, the evil mutant twin brother of bad cholesterol, as I call it. It's inherited from your family. It can be 100 times more sticky than bad cholesterol. The higher your bad cholesterol is, the worse the risk is. They both combine together. I always tell my patients, if bad cholesterol is Elmer's glue, this is the crazy glue. They stick together, and it can cause a lot of havoc. Your level increases with age. It's much worse in women than it is with men. Women with the highest levels double their cardiac risk. And diabetes, women with diabetes and a high level, actually 6 times more risk of heart disease and worsens your outcome. What do you think? I mean, about both of these markers? C-reactive is a big argument. We're going to talk about it in a couple.
We can argue it's back and forth about C-reactive. Actually, we don't need to argue between ourselves because we both agree. We should argue with the folks that say that it's not a value, because it is clearly independent of everything else. C-reactive protein increases a woman's risk of heart disease, and we actually know now from the Jupiter trial with rosuvastatin, I'm
going to talk a little bit about that,
whether or not that actually it may reduce your risk. And so, I check it in patients, especially when I'm looking for high-risk features, such independent of other issues of lipid parameters. If your cholesterol panel is normal, your C-reactive protein is up, then you're still at risk, and you probably warrant some treatment.
Well, we're going to have a whole show on C-reactive protein, number one. And number two, in our last segment, which is always what you can do about it, we'll talk about who really should get screened for C-reactive protein. We'll give you folks out there some tips about that. Pop quiz, going into our break, to avoid high blood pressure, which has the greatest impact in women? Your diet, 30 minutes of exercise, a lower BMI, that's your body mass index, less than 25, meaning weight loss, or moderate alcohol consumption. Which one has the, in terms of avoiding high blood pressure, which one has the greatest impact for women out there listening to this? I think it's really an issue because we're trying to get everybody to modify all risk factors. Notice I didn't say anything about high blood pressure in talking about the risk factors leading to heart disease, and yet high blood pressure is such a large impact on men and women in general. So we'll answer that question when we come back.
More Dr. Scott and Smarter Heart University is on the way on AM 970, The Apple.